Good afternoon, ladies and gentlemen. I am Terence Esibum, heading the Public Relations and Health Promotion Unit at the Ministry of Public Health. This afternoon, it is my distinct pleasure to introduce to you the Honorable Minister of Public Health, Valdo Lawrence, who is going to bring us another update on COVID-19 in Guyana. Over to the Minister.
Thank you, Mr. Esibum. Fellow Guyanese and members of the media, I wish to thank you for joining me for today's COVID 19 briefing. And as the Ministry of Public Health apprises you of the current statistics on the global, regional, and national COVID 19 pandemic. Ladies and gentlemen, as of the 28th of March 2020, the updates are as follows. Globally, the number of confirmed cases in 201 countries and territories stands at 621,636, with the number of deaths at 28,658. In the region of the Americas, the total number of confirmed cases has increased from 81,139 to 100,314, with the number of deaths moving alarmingly from 1,176 to 1,485 in 51 of the 55 countries. In Guyana, as of yesterday, 27th of March 2020, the number of confirmed cases has moved from 5 to 8, with the number of deaths remaining at 1. The total number of persons who have been tested has moved from 39 to 44. With regard to persons in institutional quarantine, the number is now 31, while the number of persons on home quarantine has now changed. 7 persons are now in institutional isolation by the Ministry of Public Health, and the ministry continues to offer psychosocial support for those in need of these services. With regard to our capacity to respond, in addition to the 4 facilities which are ready to provide services for 350 persons, all regions now have capacity centrally to cater for an additional 134 persons. As of yesterday, calls to the COVID-19 hotline moved from 773 calls to 856. These calls were received from 9 of the 10 administrative regions. In my report yesterday, I mentioned PAHO's donation of test kits to the ministry. I wish to express the ministry's gratitude to our partner, PAHO, for this donation and to highlight the overwhelming support that we have received during our preparatory planning and implementation of our national response plan since our first confirmed COVID-19 case was reported. I also spoke of receiving ventilators from our suppliers to cater for our level 3. Let me clarify for you, fellow Guyanese, that I'm not referring to health facilities, but to the levels of illness which are categorized as mild for those persons not requiring hospitalization, moderate for those persons requiring hospitalization, and severe where more specialized care is a necessity. Fellow Guyanese, 2 days ago, I clarified for you the situation of the Brazilian national that tested positive for COVID-19 and is in quarantine in Bonfim, Brazil. I wish to update you on other activities presently being done in Upper Takatu, Upper Essequibo to fight the coronavirus disease. 3 sensitization sessions have been done involving several of the stakeholders. The regional task force has been established. Sensitization sessions continue with the business places, banks, and other stakeholders. Visits to public places to ensure that they are implementing measures and taking precautions and following the infection control protocols are ongoing. Sanitization of public places such as market, public health, and border complex continues. Visit to the villages using the PA system to promote precautionary measures. Sharing of flyers with COVID-19 information is ongoing. Radio Let-Em continuously giving information and programs on COVID-19 continues. Visits to several of the non-conventional ports of entry into Guyana was done. These visits revealed that the Brazilian Army is present at several of the popular crossings, and Guyanese police are at several of these locations. The task force continues to work with the police, army, and immigration to assist with the monitoring of these crossings. Village leaders have taken the initiative to institute checkpoints in 2 of the districts, namely Sand Creek and Ishalton, to monitor entry. Let-Em Hospital has an isolation room presently with 4 beds, but the capacity can take up to 7. And the necessary protective and sanitization supplies are in place. The hospital has implemented sanitization practices for all staff and patients entering the facility. Supplies, that is protective and sanitation, have been sent to the main health centers and hospitals in the districts. Congratulations to you all in the Upper Takatu, Upper Essequibo. Fellow Guyanese, I wish to update you further on the prisons and the elderly homes. Recognizing the vulnerability of these groups, infection control measures are already being instituted and monitoring is ongoing. I now wish to apprise those persons who are concerned about the measures taken regarding the closure of our official points of entry. I have chosen just 2 countries, namely Singapore and Ireland, as examples to highlight the disease trend, which reveals that the majority of the cases diagnosed are imported as compared to local transmission. Please note the diagrams which are highlighted on the screen. You will notice that the number of imported cases of COVID-19 in Singapore outweighs the local transmission. During a 1-week period, 20th through 26th of March, most of the confirmed cases of COVID-19 were imported. You would note the blue represents locally transmitted cases as opposed to the yellow, which represents imported cases. From Singapore's experience, we can clearly identify that their imported cases is almost 100% higher than the local transmission. In the diagram reflective of Ireland's COVID-19 trend, the number of imported cases from 7 countries was 187 out of a total of 302 cases. You can agree from the illustration that in both countries over the last week, the impact of the imported cases is contributing significantly to the country's coronavirus disease burden. Once again, we ask that you visit the Ministry of Public Health and PAHO WHO websites for credible information that can help you to understand the measures Guyana is taking. All that is being done in an effort to protect all of us. Remember, social distancing, coughing etiquette, and hand washing can take us a long way in this fight against COVID 19. Thank you all.